Hello everyone, welcome to Doctor's Notes. Today we are going to learn about cardiac action potentials. I'm going to explain very simply and clearly so that you're all set to tackle questions about this topic for your boards, as well as get a strong foundation in action potentials and how it's going to help you in the future as a doctor. Okay, first, before we dive in, why do you think we need to learn about cardiac action potentials? If you're thinking about EKGs, drugs, you're in the right direction. A strong foundation of cardiac action potentials will help us interpret EKGs clearly, as action potentials directly influence changes seen on EKGs. Plus, almost all antiarrhythmic medications work by targeting specific phases of these action potentials we are going to speak about to modify the heart's rate, rhythm, and help manage a range of cardiac conditions. In fact, there's an entire cardiac super specialty called a cardiac EP that just reads and specializes in this art form. I like to call it an art form because it is an art, learning how to interpret EKGs and work with the cardiac rhythm and potentials. Okay, so let's begin. Before we dive into action potentials, I want to give you a brief introduction to the cardiac myocyte first. Okay, so let's start by drawing a cardiac myocyte. So I believe they're going to look like this. Okay, now let's separate these cells. Does anyone know what I'm drawing here? Do you know what these like zigzag lines are? I'm just separating these cells with a line, and these lines are called, if you're thinking about intercalated discs, you're right. These are intercalated discs. Okay? Nothing but a fancy name for gap junctions. Nothing else. Okay? So it helps each cardiac myocyte to stay in communication with each other, and it's really fast. Okay, they can communicate almost instantaneously with each other. That's the whole point. Okay, now how do these cardiac myocytes get activated? Do they activate themselves, or does someone else help them? Yes, if you're thinking about pacemakers, you're correct. This is where pacemakers come in. Our heart is one of the only organs across all of like all animals even. Okay, it's unique because it has the ability to generate its own action potentials without any external stimulus. There are different pacemakers located in the heart, not just one, and they are responsible for initiating this process. And after they develop an action potential, they are then transmitted to the cardiac myocyte, which then develop action potential. So let's assume this is the SA node, and this is how it's going to look like. Okay, so if this is the SA node, once an action potential begins, this action potential is going to be transmitted almost instantaneously to the neighboring cells, and then it spreads to other pacemakers that just help propagate this process faster. Okay, now SA node, that's what we're primarily going to be talking about. It is the primary pacemaker of the heart. It's located in the upper part of the right atrium. You can see that here. So it's somewhere here, actually. It should be somewhere here. Okay, let me see if you can see that. So it's here. Okay, it's going to be here somewhere. And SA node sort of like creates a stimulus. It goes everywhere. After it goes everywhere, and then it goes to the AV node, and then the AV node sort of propagates it. It's an entire process that just travels across the entire heart, and then it travels ultimately everywhere. Okay, now we are going to talk about first how SA node is able to activate itself, and that will help you understand cardiac potentials even more clearly. Let's begin. Okay, let me first draw the SA node. Okay, this is sort of like a picture I have that is just a very primitive picture of how the SA node is going to function, but it's going to help me explain better. Okay, like all cells, our SA node as well has an important pump that's just seen in all cells in our body, not just in humans, in a lot of other animals as well. Okay, so this pump, as you may already know, is called the sodium potassium ATPase pump. Okay, and what does this pump do? It pumps out I'm waiting for it. It pumps out 3 sodium and pumps in 2 potassium. Okay, So you already see that we are getting 3 sodium out and we are getting inside 2 potassium. And there's also another pump here called the potassium pump that's also always there. And this pump just slowly, spontaneously pushes out potassium. Okay, and it's a gradual and spontaneous process. These pumps are always activated, and these processes gets happening on and on and on, over and over again. Okay, this is not just exclusive to the SA node or pacemakers. It happens in almost all the cells in our body. Okay, with just a few minor exclusions. Now, what is this process doing? If you notice, since 3 sodium is going out and also potassium is being pushed out, the membrane potential, the membrane here, the outside of the SA node cell, is going to be relatively more positive, right? It's going to be all positive here. Okay, I'm only talking about around the membrane, so it's the membrane potential. Okay, then what are these going to do? Just create a positive charge outside. That's what's going to happen. These ions that are pumped out outside. So what's going to happen inside of this membrane? It's going to be relatively negative, right? Because we have only 2 potassium pumped in, and even some of that is gradually getting pumped out. So the inside membrane is going to be relatively negative inside of the SA node. Okay, so I hope you understand this clearly. This is very important that you understand clearly. So this is what we call as polarity. Okay, what is polarity? Okay, polarity means taking sides. Okay, right, these are two different. Okay, these are two different. The charges are extremely different. Okay, so these are polar. Okay, the membrane is currently polar. Okay, now what's going to happen is we're going to draw the other ion channels. Okay, now I told you in the beginning that SA node is such a unique pacemaker in that it can create its own pacemaker action potentials. Other cells in our body need a stimulus from somewhere, need a nerve impulse or whatever. Okay, we need some stimulus to initiate a potential, but SA node is not like that. Why does this happen? That's because of a unique channel the SA nodes have called the funny sodium channel. Let's get there first. Okay, I'm going to draw a funny sodium channel. I'm going to draw it in a specific way so that you understand it. Okay, okay, imagine this is a bucket. Okay, let's see it from this side. Okay, let's assume that this is a bucket. Okay, okay, I'm going to draw that. Okay, I'm going to draw a few holes in here. Let's assume this bucket has a few holes. This is a funny sodium channel. Why is it called a funny sodium channel? You might ask. Okay, it's funny because unlike most channels, it just gradually leaks sodium. So imagine a leaky bucket, okay, that just lets water in all the time, okay, or out in this case into the cell all the time. So that's what's happening here. So sodium from the outside, whatever sodium is outside, it could be the sodium from this sodium potassium ATPase pump, or it could be just any sodium that's hanging around in this area that will go close to the bucket and leak into the cell. And this process keeps happening spontaneously over and over and over again. Okay, it's called a funny sodium channel, but you can call it whatever you want. Okay, it's just a sodium channel at the end of the day. Okay, so what's going to happen now? We have new sodium that's coming in, right? We have sodium that's coming in. This sodium, as we saw before, is going to make some changes to the charges around the membrane, because we know that the membrane has a negative charge right now. I'm not saying that it's negative inside, I'm just saying that it's relatively negative. It's important you understand that it's relatively negative compared to the outside membrane. Okay, so you take this negative charge now. Okay, that's the assumption here, you work with that. Now we've got more sodium coming in, so the inside of the cell is going to become more positive because of the positive sodium that's coming in, and all of these charges are going to become positive. Okay, remember that. Okay, they're going to become more positive. Now what's going to happen as a result of this positive charge? A lot of things will be set in motion. Now is the time to understand a graph in detail. Okay, this is the graph you're going to be drawing, and this is the graph you're going to be learning about today. It's very easy to understand now that you understand the basic concepts of SA. Let's move on. Okay, I'm going to draw the graph. Let me just draw the same graph here so that you understand it. So let's just draw a line, another line. Okay, there we go. Okay, let's assume, I'm going to give a few numbers, but I want to explain this in detail later. Okay, so I want to start with this process. So there was a net negativity around, and now that is slowly become positive. Okay, let's assume that is the state of the SA node right now. The SA node, before the funny current of sodium is activated and the sodium ions are coming in, okay, these sodium ions, before they come in, the charge around the SA node is going to be around minus 60 millivolts. Okay, as the sodium is coming in, the positive charge, the positivity around the membrane is going to increase, and it slowly is going to become more positive, and it's going to reach minus 40 millivolts. Minus 40 millivolts is like a threshold. Remember that. It's like a threshold. As in, imagine a door, okay, that's going to let more people in. That's what it is. It just activates more channel. Okay, so I'm going to draw 4 here because it's called phase 4, but don't be confused why I'm calling it phase 4. I'll get to that in the end. You'll understand this much more clearly. Okay, let's go to the next step in the between. Now, as the sodium ions are coming in and causing the SA node to reach a more positive millivoltage, in this case negative 40 millivolts, it's going to be a door that's open and is going to activate another channel. This channel is called an L-type calcium channel. Now let's draw that here. Okay, this is called the L-type calcium channel. Okay, this L-type calcium channel gets activated. Don't be confused why it's called L-type. I'll explain everything in detail. Okay, so these calcium channels are called L-type because L is for long standing. Okay, so long lasting or standing, or call it whatever you want, long lasting calcium channel that stays open for a while. And these calcium ions are not too fast. They come in slowly. Remember, they come in slowly. That's what's important here. What is going to happen? Calcium is also positive, so it's just going to make the membrane more positive, right? So the charge around the membrane is going to become more and more and more positive, right? I hope you understand that. Okay, as it becomes more positive, do you see that what is happening around the membrane? There's positive outside and there's positive inside. So no more the membrane is polar. It is not polar anymore. It is dipolar. Okay, and this state is called the depolarized state. Okay, and it's important you understand that. Doctors, a lot of people will throw around this term depolarized a lot of times. That's what it means. That means that the membrane potential is no longer different inside and outside. It's relatively the same. Okay, it's balanced equally. That's all it means. Okay, now what's going to happen? So calcium is activated and calcium ions are coming in. So let's draw that. This calcium ion is going to drive up the potential. Okay, and let's draw the L-type calcium. These are all voltage gated. When I mean voltage gated, they get activated at a certain voltage. A calcium channel gets activated minus 40. So remember that. Okay, and this is called phase 0 because the first phase of pacemaker action potential. Okay, this calcium entry is going to drive the charge inside the pacemaker to plus 10, about plus 10 millivolts. Remember that, around there. Once it reaches there, another door opens and another channel gets activated. I haven't drawn that here, but let's draw that right now. Okay, this channel is nothing but another potassium channel. Okay, that's what you need to remember. Okay, it's just another potassium channel. Also a voltage gated potassium channel. This potassium channel is going to cause potassium ions to exit the cell. Okay, so what happens when potassium exits the cell? Again, you're losing a lot of positive charge outside. and the potassium leaves out. So what is inside the cell? It's important to remember that sodium came in through the funny current, a little bit of that is there, and calcium came in through the L-type calcium channel. So we have this inside the cell, and imagine we have some gap junctions connecting to cardiac myocytes. We'll get there when we get there. Okay, just a moment, give me a moment. And this potassium is now going to come out. Okay, what do we draw here? Potassium channel gets activated, it's going to come out, causing the action potential to go down. So that's what's happening, it's going down. So it goes down and it brings the action potential in the pacemaker to again a relatively net negative charge. Okay, this is called the potassium channel. This is called phase 3. Okay, don't be confused, I'm first saying phase 0 and then I'm putting in phase 3. And where are 1 and 2? 1 and 2 are present in cardiac action potentials. Okay, not cardiac muscle action potentials, not the nodal or the pacemaker action potential. And this is the pacemaker action potential, right? This is the pacemaker action potential. 1 and 2 is there, and they don't want to confuse you by adding 1 and 2 here, and then you would be memorizing the differences between 1 here and 2 and 1 in the cardiac myocyte action potential. That's just a lot of work. So it makes sense. 0 and then 3. Okay, you got it? This process repeats around 60 to 100 times a minute. Okay, and this should ring a bell. What happens 60 to 100 times? What is this number correlated to? The pulse. The normal pulse or the heart rate is about 60 to 100 a minute, and that's what SA node is responsible for. Okay, I hope you understand this clearly, because we're going to have to move to cardiac myocyte action potential now. Let me start with this picture that we had, and I told you the SA node, and imagine the action potential has worked here. Now we have sodium and calcium that came in. Sodium came in as phase 4 funny current. Okay, phase 4 is called phase 4 because it happens after phase 3. So see 0, 3, and then it should be 4 again. So you understand why it was 4. Okay, so there's sodium and there's also calcium that came in during phase 0. This is going to be, these ions are going to be transmitted to the cardiac myocyte and cause the initiation of cardiac myocyte action potential, and that's what we're going to read about now. Okay, next steps. Okay, let's move on to cardiac action potentials. Okay, I'm going to again draw another circle so that I'm able to give you a better picture. Okay, we have sodium and calcium that's come in. Unlike the pacemaker, the cardiac myocyte can be in a completely rested state. Okay, that means they don't have to be activated. They don't have funny currents like sodium that come in all the time. So they stay activated. They don't stay activated for a long time. Okay, they can go to a phase called the resting phase. This phase is called the resting membrane potential, or the RMP, and the charge, the voltage at this phase is about minus 85 millivolts, and that's what I have here. Okay, it's about minus 85 millivolts. This is called the resting membrane potential. It's important you understand that. Okay, at this phase nothing is happening, the cardiac myocyte is resting. Sodium and calcium enter during this phase and cause an increase of the potential, because again these are positive charge. Okay, they cause the potential, the charge inside or around the membrane, to go a little bit more positive, in this case up to minus 70 millivolts. So from minus, again we are going to plus. And just like the pacemaker potential is minus 40 millivolts, which was a threshold potential, minus 70 millivolts is the threshold potential for cardiac myocytes. So this is the cardiac myocyte graph. Okay, that is going to activate another door, in this case a sodium channel. Okay, this is a very fast voltage gated sodium channel, extremely fast. Remember that This is called a phase 0. Okay, let me just quickly draw it here so that you understand that clearly. We have a line here, okay, and minus 85 millivolts, minus 70 millivolts, sodium and calcium coming in, and it sort of creates a threshold potential, and once it hits it, sodium channels get activated, and it's really fast. Okay, it's really fast. It goes up to, I think, about plus 20 around. Okay, it's not always the same, plus 20 millivolts. It's so fast, it's almost instantaneous, as opposed to pacemaker potential, where you see it's like a slope here, right? It's not a slope here. That's the main difference. Okay, this phase is called phase 0 because, again, this is the first phase and it's sodium channel. Okay, it takes about plus 20 millivolts. At this point, once it reaches plus 20 millivolts, what's going to happen is another channel is going to open up. Okay, what is that channel? That's a potassium channel. Remember, these are small transient channels. Okay, they are not going to be activated for a long time. This specific potassium channel we are talking about is going to be transiently open, and in fact, it's called the transient potassium channel in some textbooks. Okay, this channel allows potassium to a little exit in the cell. Okay, it's going to be a transient phase. It's going to be exiting for a short period. It's going to exit and like come around to like 0 because potassium is exiting. This is called phase 1, okay, or called initial repolarization. Why is it called repolarization? Because we were all positive here. The membrane outside, we know that is always positive. Okay, so this was a depolarized state. So the sodium coming in was depolarized state. Now potassium is going out, so the positive charge is leaving. So again, they're going back to a state of polarity. That means they are returning to polarity, also known as repolarization. But it's the initial part of repolarization. It's phase 1 of repolarization. Therefore, it's called initial repolarization. This potassium is gonna go out. Okay, once the potential reaches 0 millivolts around here, and we don't know how this has happened. Okay, we don't know how these things happen, but we do know that at 0 millivolts another set of channels open, and these are the L-type calcium channels that you saw in the pacemaker potential. Almost the same. Okay, voltage gated L-type calcium channels that are slow. Okay, they get activated, and what happens? Calcium is coming in. Okay, and at this point the potassium channel is not closing. Remember that the sodium channel closes once it reaches plus 20 millivolt. Potassium channel opens at plus 20 millivolt, but the potassium channel is not fully closed yet at 0 millivolts. So the cardiac myocyte is in a state of potassium leaving the cell and calcium entering the cell. Calcium enters. Okay, so what's happening? It's like a tug of war between potassium and calcium. Potassium is leaving out, calcium is coming in, so there's like sort of hover of potential at this point. So the potential stays around 0 millivolts at this point. Okay, it stays around 0. It's like this. It's like a tug of war where calcium is coming in. This is called a phase 2, or called the plateau phase, because you see the potential is like plateauing. So it's called a plateau phase. Now, why does this happen? This happens because this is the phase where the cardiac myocyte is actually given time and calcium ions to contract. This calcium we spoke about goes to the sarcoplasmic reticulum and helps excitation contraction coupling. And there's a lot of other calcium ions that come in outside of the ions that just came into the cardiac myocytes that help the cardiac muscle to contract. Okay, this phase lasts for approximately 200 milliseconds. Okay, and this helps the contraction of the cardiac myocyte. This is called the phase 2. So now we've seen 0, we've seen phase 1, we've seen phase 2. What happens next? Okay, phase 2 is done. So this phase is also called refractory period. I just want to make sure that you also know that, because during this refractory state of potassium slowly leaving out, calcium slowly coming in, you can, even if you deliver electric potential to the cardiac myocyte, nothing will happen, because it prevents premature re-excitation of the heart, giving the heart some time to pump blood before the next beat. It's important, right? We do need to give the heart more time to pump blood. Finally, after the plateau phase, the calcium channels sort of have like a finite level of calcium that can enter. The calcium channels then close. Okay, then another set of potassium channels open. Okay, I'm going to draw it in a different color because this is a different potassium. Okay, Okay, this is a potassium exiting. Okay, it's called a delayed rectifier potassium channels. Okay, it's a delayed rectifier potassium channel. Why that is to differentiate this from the transient potassium channels we just read, because it opens late, it stays open for a long time, and it rectifies the polarity. It brings back the polarity into the cell by creating the making the membrane potential inside negative and outside positive. Okay, that's what happens. So the potassium channel is going to open and it's going to cause a drop. Okay, it's going to cause a drop in electric potential and brings back to the resting membrane potential. So you have potassium delayed rectifier going out, and this is called phase 3. So we saw 0, 1, 2, 3. And again, when we're in the phase of resting membrane potential, this is called phase 4. That's all that happens. So regarding your confusion about phase 1 and 2 about pacemaker, you see why they were in there? Because phase 1 and 2 are present in cardiac action potentials, and they're important for this repolarization plus plateau phase, so that the cardiac muscle has time to contract. Yes, no, it does not need to contract, so you technically don't even need those steps, right? And our heart is extremely efficient, so it skips all these steps in the SA node. That's all. This is basically what happens for a cardiac muscle to contract. I hope that you've understood what has happened right now. So we have activated the SA node through the funny current. Okay, we have activated the SA node through the funny current, and that's led to an electric potential difference here. Okay, it's led to an electric potential difference here. It's caused sodium and calcium to accumulate inside the pacemaker, which could then be transmitted to the cardiac muscle here, and then the cardiac muscle has its own action potential that's initiated by this influx of sodium and calcium, a slight influx of sodium calcium into the cell. Now what happens during an ischemic phase or an infarct phase? Okay, during an ischemia or an infarct, the blood supply to one of the primary pacemakers or any pacemakers is usually cut off. Okay, then the pacemakers are not working. That could happen, and the cardiac muscle itself can also lose blood supply. So remember this: whenever a cardiac muscle loses blood supply, only the potassium channels will stay active. The sodium potassium pump will just stop working instantly because it needs ATP, right? And we don't have ATP, so the sodium potassium ATPase pump will not be activated, so it's destroyed. If it's destroyed, what's going to happen? Potassium is usually what happens here, pushed in. Sodium is usually pushed out. Now this process is going to reverse. Okay, potassium is pushed out and sodium is pushed in. Now if potassium is pushed out, what's going to happen? Pushed in, what's going to happen? The cell is becoming more and more positive. If the cell is becoming more positive, it can become depolarized, and if it becomes depolarized, all the ischemic cells will start having an action potential that's different from the non-ischemic cells. This is why on ECG during an infarct we see an ST elevation, because elevation usually denotes depolarization on an EKG or an ECG. So that's why we see an ST elevation. Okay, so I hope you understand the ischemic part of it, okay, and the infarct part of it. That's basically it, everyone. So I hope you understood everything. So what have we gone through today? We have gone through pacemaker action potentials, cardiac action potentials, how they work in synchronous with each other, okay, and how this helps us beat heart efficiently without our brain sending signals every single second. Imagine how that would be, okay, right. I hope that I've been very clear. If you have any questions, feel free to post in the comments and I'll try to answer how much ever I can, and we'll see in our next chapter. Okay, and also feel free to subscribe and let me know in the comments what sort of topics you want. And I just want to make your lives easier as medical students and doctors. I want everyone to learn better, learn efficiently, and understand everything clearly. Okay, thank you very much. This is just my first video. I apologize if it's not as good as it's supposed to be, but thank you very much. Okay, bye bye, have a great day.